You are listening to the Aging Starts Now podcast, where it's all about responding with confidence to the legal, financial, and personal challenges created by a disability, unexpected illness, or aging in general. Join us weekly as elder law attorneys Barbara McGinnis and Chris Johnson, along with other members of the Johnson McGinnis Elder Care Law and Estate Planning team, talk about the tools, techniques, strategies, and services that will make the elder care journey easier for everyone involved. Get ready, because aging starts now.
If you've ever cared for an older loved one experiencing dementia, you may have heard the phrase med management or Geri Psych, but what do those terms actually mean for you and your loved one? I'm Deborah King, a licensed clinical social worker and elder care coordinator at Johnson McGinnis Elder Care Law and Estate Planning. And on today's episode of Aging Starts Now, we are speaking with Lori Jacobs, the intake coordinator at High Point Health Behavioral Health, Sumner. Welcome, Lori.
Hi, thank you so much for having me.
Oh, I'm so glad you can join us. This is an issue that we hear about a lot in our practice. And so let's start out by telling our listeners what exactly is geriatric inpatient behavioral health.
Yes, so there is a lot of questions that go around as to what do we do here at the unit. So basically, geriatric inpatient behavioral health, it refers to specialized mental health care that is provided in a hospital or facility setting for older adults. In most cases, you may see someone the age of 65, or most facilities are, hey, we got to cut off at age 65. But we have adjusted our age to 55 and older. So, and those patients that come to us are often experiencing acute psychiatric or behavioral issues that require intensive treatment and monitoring.
So it's good to know if someone, I think generally with dementia or behavioral issues or mental health issues, but they're elderly, they're not going to be put in a general psychiatric population. They're going to be separated out because we recognize that they have special needs, especially if they're memory impaired, right?
Yes, absolutely. We never want our geriatric population to feel like they are just being thrown to the wolves, especially when there are adult psychiatric facilities out there. We all know that adult psychiatric facilities, they can be difficult, they can be challenging, and it's not a safe environment for the geriatric population to go and get the help and the care that they need. So here at our facility, we offer hands-on techniques to make sure that these geriatrics receive the best care possible in a more comfortable setting, so they're not having to constantly worry about someone else hurting them or causing harm to them.
Or being afraid, right?
Yeah.
Right. So what are some signs families need to look for? Who might be a candidate for geriatric behavioral health, or what we refer to Geri Psych?
Yes. So, there is a lot of things. I mean, because it's a broad topic when you think about mental health. Any and everybody can be a candidate, because at some point in time, we're all suffering from a type of mental health. But those that are candidates for our particular unit, they are 55 years of age or older. And they may be dealing with dementia-related behaviors such as aggression, agitation, hallucinations, severe depression, suicidal thoughts, homicidal thoughts, anxiety disorder, bipolar disorder, schizophrenia, and other psychoses, and then significant behavioral changes that the families may not have noticed, that may have just appeared, and they cannot be managed at home safely or in the nursing facility. So those are the appropriate candidates for our particular unit.
Right. So we hear about it a lot when someone, like you said, has behavioral problems where maybe they're getting aggressive or agitated all the time and they can't be calmed down or redirected, and the PCP can't manage it. Or maybe I've even had some that are just severely depressed and apathetic and need some medication management to help get them back on track.
Yes, absolutely. And we see this quite a bit, especially in the older population, geriatric population. Not really, a lot of families do not really know what to look for when it comes to taking care of their loved one. There is kind of like a stigma around, inpatient behavioral health treatment. But the reality of it is we all need help. And those that are older, they may need a little bit more extra help. And so that's what we're here to help them with through this time.
Absolutely. So what happens when they're admitted to their unit? What kind of services are they getting?
Yeah, so we offer a wide range of services, and this is something that we are very proud of here at our at the facility and as a whole for our unit. So the families can expect crisis stabilization. No matter the situation, no matter the circumstances, we are able to come in and stabilize that patient. We have 24/7 clinical support from licensed behavioral health professionals, which is like our psychiatrists, and we have other team members that are on board to help in that care for your loved one or for their loved one. And then we have 24/7 medically trained staff. So we have a medical doctor that comes into the facility to focus on the medical needs of the patient to make sure that they are medically stable to continue services here with us. And then we continuously monitor the patient. Medication management. We may have a patient come in and they are no longer taking their medications. Then we help them get back to the point of taking that medication, and then work with them throughout the process. Individualized therapy. We do have a amazing social worker who goes around and she focuses a lot of times one-on-one therapy with the patients, as well as a group therapy. So they do individual and group. And then we also have our social worker also does discharge planning, and she coordinates with the facilities or outpatient providers for the continuum of care. So when the patient is discharged from us, the ball is just not dropped. We continue on with that care to ensure that they're being taken care of post-discharge. We have a recreational therapist, and what that goal is to we keep them involved. We keep their minds active. We are constantly doing crafts. We do trivia with them. And then other aspects, we do motion and movement. So they are getting exercise every single day. Memory impairment, focused therapy, and then as well as structured daily routines to promote healing. So we have a very structured program scheduling that the patients work through during their time here. And then we just encourage them to participate in that programming because that is a course of their treatment plan.
I've seen that schedule, and you do keep them busy every hour, but you also allow times for rest breaks and general quiet time. And it's an inpatient unit, so they're getting their meals. They're in a hospital room, but do they wear their own clothes?
Yes, so we do allow each patient to have at least 3 changes of clothes. Of course, with us being a behavioral health unit, there is some restrictions on what the patient can and can't have. So we limit them to have three pairs of clothing. They cannot have strings. They cannot have jewelry. They cannot have makeup. Basically, it's just for their safety. Anything that could be of a ligature risk that could cause harm to themselves or to others. So yes, and then, we do have a washer and dryer here on the unit, which is amazing. So, if any of the clothes get soiled or something like that, then we are able to utilize that and ensure that they get good and clean clothes. And it kind of makes them feel more comfortable being in their own clothes. But yes, we do allow them to have like their own clothing and things. We just monitor any other belongings that are brought into the unit for safety.
What's the average length of stay?
So I get this a lot, and it basically depends on how the patient responds to treatment. into the programming schedules. So the more they participate in the programming schedules, the closer and the sooner they're going to get out of here, because that is part of their treatment plan. So we typically see patients in-house from 5 to 7 days, but it could be a little bit longer if needed for maybe possible more med stabilization. But I haven't really seen it go past 10 days.
Okay. Do families get to visit during that time?
Yes, we do welcome families to come onto our unit. However, with it being a more structured unit, we do only allow visitation from 4:30 in the afternoon to 6:30 at night. And that's 7 days a week. So we do allow families to come onto the unit. We allow 2 visitors at a time. And during that time, we do ask that all families, check in at the nurse's station once we let you into the unit, because again, it's a locked, secured unit. And then all of the family members' belongings will be secured at the nurse's station. And that's also for the safety of patients here on this unit. So, but yes, we welcome visitors to come, just 2 at a time.
Okay. So what's the referral process? My PCP says I need Geri Psych, or I'm having problems at home managing my husband's behavior. What happens? What do I do?
So, yeah, this is the process that we are currently working to better streamline and to better serve our community. So this is something that I've actually been able to try to focus on some, but with some changes here on our unit, we've kind of had to halt that at the present time. But we are looking at doing some changing to that where we can go forward and do direct admits. But as of right now, if a nurse practitioner tells the loved one to take their family member to the ER because they need inpatient psych placement, then, typically they send me a referral and I can call down to the ER. But we always have to have a medical clearance before a patient can come up to our unit. And that medical clearance can entail blood work. Make sure they do not have a UTI, because a lot of times UTIs can cause a patient to have behavior issues, especially of the older population. So that's some of the things that we look at. We also make sure that they don't have pneumonia or anything else that could be causing their behaviors. So unfortunately, we do have to have that medical clearance. Now, if they're coming from one hospital to another, then there is no medical clearance needed. They're obviously medically cleared from the other facility. But as I mentioned at the Geriatric Council the other day, is that, if there is an assisted living community, memory care, or even a SNF or a long-term facility, if they know someone that needs inpatient psych, then they can always call me directly at 615-328-5418. And I will be more than happy to call the emergency room and say, hey, I've got somebody coming in to the ER by this name. Let's make sure that they're medically cleared, but also we do recommend a telepsych. And at that point in time, that will give us a complete understanding if that patient is, in fact, inpatient psych appropriate.
Okay, that's good. Who pays for this? Does insurance cover it? Medicare or the Advantage plans?
Yes, so we do have a good payer source. All insurances cover our services except for TennCare. We are unfortunately out of contract with UHC and AARP. However, it's not a problem for me to call and get an authorization for their inpatient stay here. But we are in contract with majority of the insurances, no problem as far as like Medicare, managed Medicare. But TennCare has been a problem with it being a primary insurance. Unfortunately, we cannot take that.
Okay. So what else do we need to know? How can we get in touch with you? You want to give us your phone number again?
Yeah, sure. So you can always reach out to me. Again, my name's Lori Jacobs. I'm the intake coordinator here at on the behavioral health unit. My phone number is 615-328-5418. And for any referrals, they can be faxed directly to me at 615-328-5098, Or you can send an email to me at Lori, Lorie, .jacobs, JACOBS, at lpnt.net.
That's great, Lori. I think you shed some light on families that are looking for help with behavioral problems with agitation, especially for our elderly population. And if you have more questions, you can get in touch with Lori, or you can contact us here at Johnson McGinnis Elder Care Law. That's all we have time for today. If you know someone who could benefit from this episode, please share it with them. Johnson McGinnis Elder Care Law and Estate Planning is a life care planning law firm helping families navigate the complexities of aging, including how to find and fund care prior to or during a health crisis. Join us next week for another episode of Aging Starts Now.
Thank you for listening to the Aging Starts Now podcast. For more information about today's show, visit tn-elderlaw.com, click on the Free Resources tab, and then click on Aging Starts Now. You'll find the show notes there. And while you're at it, why not check out all the free resources available at tn-elderlaw.com? Document downloads, the Johnson McGinnis blog, educational videos, informative articles, helpful links, a TV show, and more. It's all there, free for the taking. If you enjoy listening to the Aging Starts Now podcast, please subscribe, rate the show, or leave us a review. It's easy to do on whatever app you use to listen. We would love your feedback on the show. Aging Starts Now. We'll be back next week with more candid discussions about the challenges created by aging, disability, and unexpected illness.